types of muscle fibers. So question being, what is the main source of ATP in case of type 1? What is the main source of ATP in type 1? And next is, what is the amount of mitochondria present in case of type 2A? What is the type of amount of mitochondria present in 2A in comparison to type 1 and type 3? Next is, what is the myoglobin content? Myoglobin content in case of type 2B. Type 2B, what is the myoglobin content? So we'll find out the answers to these questions and learn a lot more in this subject. So firstly, we are going to compare the three categories, that is 1, 2A and 2B under specific headings. So looking at it is also known as, so here looking at type 1, it is also known as the slow as well as the oxidative. Then looking at the type 2A, it is nothing but it is fast as well as it is oxidative and glycolytic. So it is known as FOG in short, and type 1 is slow and oxidative, so it is known as SO in short. Then moving on to type 2B. So in type 2B, it is nothing but it is fast as well as the glycolytic. So it is FG. Now going to the aspect of the function of these muscle fibers. So looking at the function of type 1. So type 1 function is that it is the sustained forces. So sustained forces such as the postural muscles. Next we move on to the type 2A. So in 2A, it is nothing but the powerful muscle movements. So it is nothing but the powerful muscle movements, which is the type 2A. Then we move on to the type 2B. In type 2B, it is nothing but the powerful fast movements. Powerful fast movements is type 2B. Next what we see is the main source of ATP. The main source of the ATP. So in case of the main source of the ATP, it is the oxidative phosphorylation. Oxidative phosphorylation, this is in case of the type 1. Next, moving on to the type 2, the main source of the ATP will be the oxidative phosphorylation again. Then we move on to the type 2B. In type 2B, in type 2A also it is oxidative phosphorylation. In type 2B, it is glycolysis. Then we move on to the size of the motor unit. Size of the motor unit. So looking at the size of the motor unit, type 1 is small. Okay. Then type 2A is large. So is type 2B. This is also large. Then we look at the mitochondria. So what about the mitochondria? So in case of the mitochondria, in type 1, the mitochondria is many. There are many. And looking at type 2A, it is intermediate. So it is lesser than 1 and more than the type 2B. Next we look at type 3, that is 2b, this is 2a. So in case of type 2b, the amount of mitochondria are few. Next we look at the capillaries. So capillaries are many, this is in case of type 1, and they are also many in case of type 2, and they are few in case of type 3. Next we look at the myoglobin content. So myoglobin content is high. It is high in case of type 1 and 2a, and it is low in case of type 2b. Then we look on to the color. So when we see the color, it is in case of type 1, the color is red. In case of type 2a, it is also red, and in type 2b, it is white in color. Next we look at the myosin ATPase activity. Myosin ATPase activity. So in case of myosin ATPase activity, it is low in case of type 1, and it is high in case of type 2a and the 2b. So what about the glycolytic capacity? So in case of the glycolytic capacity, it is low in case of type 1, and it is intermediate in case of the type 2a, and it is high in case of type 2b. Next we move on to the OC, that is the oxidative capacity. So in case of the oxidative capacity, the type 1 is high, and in case of type 2, it is nothing but it is intermediate, as well as in case of type 2b, it is low. Now looking at the last step, that is in case of the resistance. What about the resistance to the fatigue? So in the resistance to the fatigue, the type 1 is nothing but it is fatigue resistant, and looking at type 2a, it is fatigue resistant, and looking at type 2b, so here it is fatigue susceptible. Now we move on to finding the answers to the questions. So the first question we asked was, in case of type 1, what is the main source of ATP? So here the answer is that the main source of ATP is by the oxidative phosphorylation. The next question was, in case of the type 2a, what is the amount of mitochondria present? So the mitochondria will be that type 1 has the most mitochondria, followed by type 2a, followed by type 2b. So it is intermediate. Next is the amount of myoglobin content. This is in case of type 2b. The amount of myoglobin content will be low. Whereas in comparison to type 1 and 2a, it is high.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.